Hi, this is Dr. Ginger Lee. I want to continue to show you guys exercises on a regular basis. One of the things that I hear a lot and I teach a lot to patients that not everyone understands is the concept of diaphragmatic breathing and how to use your belly musculature. One thing that people misunderstand is when you ask somebody to breathe with their belly, first of all, they have no idea what that means. The second thing is, when you breathe with your belly, it's not just the front that's going forward, backward. It's your entire cavity that goes all the way around to your spinal segments and also down into the pelvic floor. Okay? So think about it this way, the diaphragm muscle is a whole dome, it's an umbrella. Think of an umbrella this way, it sits right here under the lower floating ribs, right? Attaching to the floating ribs. So the diaphragm starts out with a dome like this, and then when you inhale, it contracts downward to open up your thoracic, your chest cavity. For your lungs are here, so the lungs are expanding down and out this way, out this way. So the diaphragm moves down like this. It displaces the abdominal cavity. So when it displaces, the abdominal cavity has to go out in circumferentially, and it has to go downward. Okay, so when you're breathing, there's several ways of breathing. But if you breathe here using your diaphragm, then you're going to make your belly in the front go out. And your belly button should go out. So when you breathe in, like that. So when you're breathing in, this goes out. I'm going to put my finger here to see, so you see that it's moving. And then when you breathe out, you can actually pull inward so that this area now, everything circumferentially pulls in. So think of an old time long ago where people used to wear corsets. Or think about braces that people wear to the home improvement store to carry and lift things, or the guys wearing a weight belt at the gym, right? So you're surrounding yourself with a brace, okay? But naturally, we have that brace. We have that brace in the form of musculatures all around the belly, the flank, the spinal muscles. So think of that going out when you're inhaling. So everything should go out. So if you see a balloon, the whole balloon doesn't just pop out and hernia at one end, right? The balloon doesn't just go here or there. The balloon is going to go in a whole circumferential expansion. So your belly button moves out, your flanks move out, and then your spine, the lower part of your back, is also moving out. And that's how you can reduce back pain, is when you're breathing and you're expanding your back. Actually, think of these as spinal segments stacking on top of each other, right? So they're tight like this, and when you breathe, they go out and go in and go out. So your spinal segments are stretching while you're breathing. You're doing abdominal breathing. And then your pelvic floor, where everything sits and you're supposed to be voiding and you're stopping your urine or your other, part 2 from flowing out anytime, right? You want to have that contraction and that expansion. Okay? So everything circumferentially should work. So here, I'm going to put my hands here, and when you breathe, you see that expanding? I stand up and you see my low back here, so some people's low back are really arched this way. Very, we call it hyperlordotic, okay? So you want to expand here for this part to come out. So when you breathe, so if you watch here and here, these two should be coming in and out. And then going all the way in as you exhale deeper and deeper into your spine. Okay, so when you are exercising, pay very close attention to the lower part of your abdominal and flank and low back. Where you usually, if you feel low back pain, and then when you're arching and you're getting that dip in your back, that's the part that you can think of as another belly button. So you have a deep belly button in the front, you have a little whole belly button here, and then you have another belly button back here. Think of it that way. So when you breathe, two belly buttons should go out and go in. So they go out as big as they can, and then they go in all the way as small as they can. So you're gonna go like this again. I'm gonna repeat. Count how long I'm breathing, okay? Count for me as I breathe, okay? Go ahead.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
All right, so if you notice the count, if you breathe too fast, like, or you try to go, and you try to grab the air in real fast, you don't really have much time to expand. So when you breathe, you want to take, if you are so used to breathing short, shallow breaths, then start out with just 5 seconds going out and 5 seconds in, okay? And then after a week, you practice 7 to 10 seconds out and 7 to 10 seconds in. Okay, that way you're giving yourself time to pause, slow down, and get the air in slowly. You're not rushing air in, you're not rushing it out. Okay, so I'm going to repeat again. We're going to do 10 counts, and Jules going to count. We're going to breathe.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay, so everything big for 10, keep going, keep going, keep going, and then keep going, keep going, keep going this way, right? So that's the explanation for this area. Just a few other things I want to explain to you is a lot of time we tend to breathe with the chest, okay? So let's say if your doctor tells you, okay, take a deep breath so they can hear your lung sounds, right? Or heart sound. And then you go, and then you hold, and then you kind of, okay. That's only for that time when you're getting evaluated for your lungs, okay? You don't really have to do it like that either, but if you do, it's only for that one particular thing, okay? Every day, when you're breathing, you don't want to do that. So think about if you're going to breathe every minute, right? We all breathe every minute, 24 hours a day, right? If you breathe, and let's say if you breathe, let's say just 20 times, okay, per minute, right? You go like that, and you're raising your chest and you're raising your shoulders 20 times every minute. And there are 60 minutes in an hour. So if you take 20 times 60, what do you get? You get 1,200 times. So what you're doing is you're moving your chest. You're moving your shoulders 1,200 times. Did I say that right? Okay. So if you do it like that, then you're overusing. You're like doing repetitive injury syndrome to yourself, right? You're doing this. You're repeating too many times, 20 times 60, okay, in that 1 hour, okay? You're doing that every hour. So think about breathing down this way instead, and calm down, quiet down your shoulders, keep your shoulders down. So when you breathe with your belly, the shoulders hardly move. But if you pay attention, you're thinking about it, sometimes your shoulders might do this, and then the next time you just stop it from moving. Okay? So try breathing every hour, 10 repetitions of belly and low back breathing. Thank you. Keep following my instructions. Thank you for watching. Please follow us on YouTube. You can call my office at 813-631-9700 or go to our website at gingerhealth.com. Have a great day.